Whenever I think about patients and their care, I don't really think anymore about diagnosis, which is weird. I mean, I do a little bit with meds, but I really increasingly see people on kind of a matrix of risk and resilience. Like the concept of diagnosis and like 5 out of 9 criteria, it's like, meh, wrong. I just line up in my mind strength, resilience, strength, and then risk. What are the active risks? What are the historical risks?
What would be some of, just so I get a sense of like how your head's working when you're like, that's a strength, that's resilient. Like, can you give like specifics, like, yeah.
It's a macro assessment and it's a micro assessment. So I have one of my teens, she has BPD and episodic depression, and her risk factors are she has parents who understand her, and she has self-injured a lot, and she's had eating problems. And then you add issues of like compliance would be a risk if she's not taking her meds. She usually does, but sometimes she doesn't. Or if she has a rupture in a relationship, that would be a risk. Or she's particularly protective of her intelligence. And if she feels that her intelligence is questioned or impugned, that's a major risk for her. And then on the resilience side, you've got her intelligence, her creativity. She comes in and she sketches and she sort of roots into her sea. A lot of my psychotherapy patients who are teens really are in the arts. They have artistic expression. That is a primary resilience factor. She has a long-distance boyfriend. There's a resilience factor there. The relationship with me is a resilience factor. And I know this person many years, and I've been working with her a lot. And I would love nothing more than to like bring her here and be like, look, dude, it's this, and this. If you could just get it and just stop with the defensive stuff and just hear what I'm saying, you won't need to be in any more treatment. In my heart, I wish so deeply to give this to her, and I can't, because she's not, the risk factors overwhelm the resilience factors. And when you feel depleted and miserable, it's very hard to work on yourself. It's very frustrating. But the pacing is determined by the risk resilience matrix, and the intensity ebbs and flows in accordance with her life.